Practice First Medical Management Solutions. Practice First presents evaluation and management documentation tips, a guide to thorough documentation for current coding guidelines. One of the most important and critical communication tools in patient care is the patient's medical note. This video will provide tips to help you capture the work involved in patient care and create a note that is in harmony with the current E&M guidelines. A well-documented note will help to ensure proper reimbursement for the level of care you provide. One of the most important facts to keep in mind is that your thought process throughout the encounter must be documented. Simply clicking boxes in an EMR or EHR does not create a note that represents all the work performed during the encounter and won't stand up to payer audit. The provider has the option of using medical decision-making or time to score the E&M level of each encounter. In this video, we will provide documentation tips applicable to both scenarios. Regardless of which scenario you use to score an E&M, medical necessity must be evident in the note. Medical necessity is the overarching criterion in selecting a level of service. Document a valid chief complaint or reason for the patient seeking care. Per CMS, the chief complaint is a concise statement that describes the symptom, problem, condition, diagnosis, or reason for the patient encounter. Patient evaluation is made through history, exam, routine laboratory tests and other diagnostic procedures. Per AMA, a problem is addressed or managed when it is evaluated or treated at the encounter by the physician or other qualified healthcare professional reporting the service. This includes consideration of further testing or treatment that may not be elected by virtue of risk or benefit analysis or patient, parent, guardian, or surrogate choice. Notation in the patient's medical record that another professional is managing the problem without additional assessment or care coordination documented does not qualify as being addressed or managed by the physician or other qualified healthcare professional reporting the service. Referral without evaluation, by history, examination, or diagnostic studies, or consideration of treatment does not qualify as being addressed or managed by the physician or other qualified healthcare professional reporting the service. Add a medically appropriate history and exam. What is medically appropriate? Per CMS, it is at the discretion of the provider to determine what is medically appropriate for each encounter. Document if these activities were performed. An independent historian provided history in addition to the history provided by the patient. An independent historian was used to obtain the history as the patient was unable to provide one. An external note from a unique source was reviewed. A unique source is defined as a physician or other qualified healthcare professional in a distinct group or different specialty or subspecialty, or a unique entity. If the problem you are addressing at the encounter is an acute illness, make sure that you are documenting if it is stable, uncomplicated, has systemic symptoms or poses a threat to life or bodily function. Let's see what details to document if the condition being addressed happens to be a chronic illness. Is the chronic illness stable or exacerbated? If exacerbated, is the exacerbation mild or severe? Is there a progression or side effects of treatment of the chronic condition? Is the chronic condition now posing a threat to life or bodily function? If the problem being addressed is an injury, then is it complicated or uncomplicated? Does the injury pose a threat to life or bodily function? An undiagnosed new problem with uncertain prognosis is when a problem in the differential diagnosis represents a condition likely to result in a high risk of morbidity without treatment. List the signs and symptoms along with your differential diagnosis and the testing and diagnostics that you are ordering to rule out or confirm the differential diagnoses. Document when you are ordering a unique test which is defined by the CPT code set. If you are performing an independent interpretation of a test for which there is a CPT code, and an interpretation or report is customary, be sure to include this in your note. Also, if you are discussing the management or test interpretation with an external physician, QHB, or appropriate source, make sure your documentation notes this. An appropriate source includes professionals who are not healthcare professionals but may be involved in the management of the patient. Examples of an appropriate source are a lawyer, parole officer, case manager, and teacher. Now let's talk about patient management in terms of risk of complications and/or morbidity or mortality. It is important to document the risk involved in the patient management. The provider's documentation of his or her level of risk assessment based on the specific patient's risk factors is the determining component in how the MDM level of risk for the specific patient will be calculated. Per AMA, risk is the probability and/or consequences of an event. The assessment of the level of risk is affected by the nature of the event under consideration. Definitions of risk are based upon the usual behavior and thought processes of a physician or other qualified healthcare professional in the same specialty. Trained clinicians apply common language usage meanings to terms such as high, medium, low, or minimal risk and do not require quantification for these definitions. The risk of patient management criteria applies to the patient management decisions made by the reporting physician or other qualified healthcare professional as part of the reported encounter. It is important to document the applicable details of the patient management options. Please take a few minutes to read through the bullet points related to patient management. Another option of leveling an E&M encounter is utilizing the time spent on the visit. If you choose to use this option, it is important to document the total time in the note along with an outline of activities performed. Please take a moment to read through the list of activities that can be included in the total time spent on the encounter. In accordance with the current E&M guidelines, the level of the service is dependent on the medical decision-making or time spent on the encounter. Not documented, not done. It is imperative that your thought process is documented within the note to ensure appropriate reimbursements for services rendered. A well-documented note will enable continuity of care and enhance communication between different healthcare professionals. Protect you against medical legal risks. Allow certified coder to apply the most appropriate CPT-4, ICD-10 codes and modifiers if applicable to each encounter. We hope you found this training video informative. Please reach out to the Practice First team with any inquiries regarding our coding, billing, or credentialing services.